All right, everyone. So we are at 6:02 right now. I just want to say for everyone who has shown up today, thank you so much. And also, I hope that you came with questions. I hope that some of this presentation is going to click in with some of those questions that you had. And I am really excited to be here. My name is Kenia Martinez, and I've been with Avance for about 3.5 years at this point. I actually focus on, let me just go ahead and make this presentation nice and big so that we can all see. So today we're going to talk about ADHD and a little bit about myself. So I focus on trauma work actually with people through the lens of eye movement, desensitization, and reprocessing, which is short for EMDR. But I really love to learn about ADHD, and I love teaching people about the ADHD because it gives the world a different perspective. So I have a lot of clients that also have ADHD that have experienced trauma. And also my partner has ADHD and a sister of mine, and I can definitely see how it impacts the way they think, the way they see the world, the issues they come across within themselves and also socially. So I am super excited to be here. So what are we going to learn today? Today, we're going to learn a little bit about what exactly is attention deficit hyperactivity disorder, how does ADHD impact us individually and socially, ways to manage symptoms, and ways that we can help our children and our loved ones that have ADHD. We are going to go through some information together, so bear with me through this lecture. And we're going to leave about 15 minutes, hopefully a little bit more if possible, for questions. So as you're going through the information, as you're hearing things, definitely jot down questions that you have for me because Q&A is my favorite part. So, and there's no such thing as a wrong answer or I don't know if this sounds not right. Go ahead and you ask whatever you feel like you came here to ask. All right. So there's actually, I know ADHD is often seen as a disability, but there is some really unique features about ADHD. There's a lot of really successful people that have it. For example, Albert Einstein was believed to have ADHD, Simone Weil, Walt Disney. There's so many people that are believed to have, especially in the areas of entertainment and sports. And the reason for that is people that have ADHD have this really amazing ability to hyper focus on a goal like no one else. And that becomes the most important thing for them. They can zone out everything, including basic needs like food. So what that means is that they can get really, really good at things really fast. Also, the way that people experience ADHD and pressure is different. So they tend to be a lot better when it comes to being on stage or when it comes to being on the spot. They tend to do really well with that, which means athletes, entertainers seem to do really well who also have ADHD. So it's not something, it's not all bad. And there are unique qualities that people with ADHD have. There is a value in all the forms that brains come into. This is just a funny little brain thing of what it looks like when we have ADHD. So that ability to hyper focus, right? But it tends to be on things that we find fun or interesting. So hyper focusing on, washing dishes or cleaning our homes or getting homework done, not a thing really, but things that are really interesting to us, we tend to be able to really hone in, which again is a good thing, but it could be a detriment when we're not paying attention to all the other parts of our lives that need care. Things also, if you know someone that has ADHD, they tend to sometimes go on tangents mentally where you're talking about one thing and they trail off way off and then need to come back. So that's something that happens a lot. And just, being able to tune into things and then forget what's actually happening right now is really common. So something that's really important when we talk about ADHD is the systemic approach. People that have ADHD have really high experience with rejection sensitivity, meaning that they're either hyper alert to, oh, wow, is this person frustrated with me? Is this person rejecting me? Is this person finding something negative with me? One, because of how the brain is organized, and also because of the experiences. People with ADHD from a very young age have experienced people that are frustrated with them, that have expectations that are really high for them, and they oftentimes have noticed that they feel like they have failed people, and that creates a lot of hurts that then show up later on in all types of in all ways in our lives. So people with ADHD tend to have are more likely to have an unstable employment. They tend to experience shame a lot more, meaning that because of the shame of the condition of ADHD, they will not reach out for resources that are provided for them. They tend to struggle with reaching out to government interaction. So if anyone's ever had to deal with like IRS, with Medicaid, Medicare, anything that has to do with reaching out to the government, you know it is a long process, and it is often multi-layered in many tasks. And so what happens is that people with ADHD will just not engage in whatever benefits are available to them because of just how overwhelming it can be. So what exactly is attention deficit disorder? So ADHD affects the brain by causing differences in structure, function, and chemistry, particularly in areas related to attention, focus, impulse, and control, leading to difficulties with executive functions like planning and organizing, as well as emotional regulation. That's all really fancy way of saying that ADHD is an organic condition, not something that is a mental health. When we think about depression or anxiety, that is a chemical imbalance. When we think about ADHD, that is a neurological condition of how the brain is set up. And this is something that we're born with. There's a lot of connection with our our genes, our genetics. It has nothing to do with the chemicals in our brains. So it is actually considered a health condition. It is not a mental health condition. And so it impacts primarily the frontal cortex, which this right here is how we organize our thoughts of like, okay, well, how do I tackle this? Or how do I plan on doing that? Or, what does tomorrow or next month look like? It also impacts how we process emotions, so that people that have ADHD sometimes feel things a lot more vivid in terms of especially those negative feelings, just because of the makeup of the brain. So some symptoms of ADHD, and there are two really important categories here. There's inattentive type, and that's when you notice things like someone has a really short attention spans. They can only kind of keep their focus on for a little bit of time, and then they just butterfly step 10 or anything. A thought came in about that show I watched last time, and that was that. Problems with organizing ourselves, failure to pay attention to details, unable to maintain attention, easily distracted, fails to finish work, forgetfulness. So you might notice that you're talking to somebody and they tend to kind of zone out a lot. Or you're noticing that, let's say it's a student or your child that you're trying to give instructions to, and they're already daydreaming about something else. With the hyperactive type, you're noticing a lot of physical energy. So that translates into fidgeting and squirming and difficulty staying seated, has trouble playing quietly, impulsive, a lot of impulsivity where they're not thinking what they're doing, blurt out the answer before the question, like, oh, I know. And then they just kind of say whatever they're going to say. It could be a lot of talkative action, just on and on and on and on. Has trouble taking terms. So they're kind of like, can't just wait for someone else to finish. They kind of tend to jump in. It interrupts or intrudes others. So that is the hyperactive type. There are a lot of people who have a combination of both. So the diagnoses that you'll see is either inattentive type, hyperactive type, or combined attention deficit hyperactivity disorder. So how exactly does ADHD impact learning new information? Why is education and ADHD such a big confrontation here? So the reason for that is it causes deficits, meaning that someone with ADHD has a lot of a difficult time with things like focus, attention, impulsivity. It causes deficits in these areas. Time management, emotional regulation, working memory. They tend to not remember things as well. And so, of course, those things are going to play a role as we are learning new material, as we're following directions. That is the areas where we're seeing deficits is going to clash with someone having expectations about what we're supposed to learn. So the why. Trouble managing emotions is a common ADHD symptoms. So again, emotions can feel more intense, emotions can last longer. So of course, this can also have an impact in the frustration that happens as you're trying to repeat information over and over to a child that has ADHD. You're going to notice that, when you say, "Are you listening to me?" That might be really, really triggering to them. And so, or an interaction with a friend where they kept interrupting the friend, or that might come back as this person hates me, when in reality is no, this person isn't feeling heard. So you'll notice that big feelings are often at the bottom here, and they're not always connected with why things happen the way that they happened. So this is something that we're born in. It's just the way that the brain is. And the way that it shows up in children again is a disorder of attention and excess movement, which is going to cause issues in school, is going to cause issues at home as we're trying to follow directions. So it's a disorder of delayed and deficient executive function and self-regulation. What that means, it's not that people who have ADHD do not have access, do not have these abilities. It's that it is delayed in age. So what that means is, if we have a child that is 10 years old, that child cognitively is really about 7. So keeping in mind that the responsibilities and expectations that we put at a 7-year-old cannot be that of a 10-year-old. So we have to adjust expectations. And so there are 5 major executive functions that are delayed in children, that impact everyday behavior and function, the way that they show up. And that's self-restraint, that's time management, self-motivation, emotional self-regulation, planning, and problem solving. So, for example, let's say you tell your child, okay, you have to clean your room today. So that's a pretty simple, okay, I got to put stuff away, I got to mop the floor, maybe I got to make my bed. So it's one task that's divided into many different things. A child that has ADHD might go and say, well, let me start by organizing. And then they say, but wait, I have to make the bed. But wait, I have to do that. But wait, I should organize things depending on color, or maybe I should just get rid of this, or maybe I should do that. And so what happens is that they get so overwhelmed that they just feel like, okay, I can't do this. This is too big. So that's how ADHD impacts getting tasks done. Also, you notice a lot of procrastination. Time management is big because time is felt different by someone who has ADHD. What can be 5 minutes to them can in actuality be a whole hour. So they think 5 minutes pass and they check the time and an hour has gone by, because it's called time blindness. And that's just part of how the condition appears. So how does ADHD impact us? So what we notice again, that people that have ADHD have higher chances of cardiovascular diseases like hypertension, increased risk of obesity. They're more likely to experience unwanted pregnancies or sexually transmitted infections. They have a higher chance of substance use risk, and all of those conditions. And that sounds pretty scary, but the reason is really simple. Remember, ADHD is about impulsivity. ADHD is about not being able to foresee what action leads to what. Which is why, if you think about habits like the way that we eat, the choices that we make with relationships, if we make that all out of what feels good or what we're interested in, we're not able to see how things are going to impact us. That means that we're more likely to make choices that are going to lead to health issues later on, or decisions that are not favorable for us. So this is where that impulsivity and compulsive behavior can really create issues here. So, and just to show also that there is a huge connection between ADHD and other conditions. So if you look over here, someone that has ADHD has a over 38% chance of having a mood disorder like depression, like bipolar disorder, whereas someone who doesn't, 11%, right? Anxiety, 47% that they will have some kind of an anxious disorder. Regular population, 19. Substance use, 15, that goes down for someone that has ADHD. Someone who's neurotypical who doesn't have ADHD, 5%. So there are just things to keep in mind in terms of that there are really big risks to having ADHD that's not diagnosed properly and early on, and that's not dealt with. So, but there's a lot of things that we can do as parents, as caregivers of people with ADHD that creates safe spaces and that creates acceptance for neurodivergent spaces for ADHD brains. One of them is really just make sure that when we are connecting with kids and people that have ADHD, our cup is full, meaning that we have to engage, we have to be creative. When, for example, we are asking kids to, let's say, clean their bedroom, keeping in mind that they have ADHD might mean, okay, well, maybe I'm going to take this task and just like break it up into little pieces. Like, okay, Timmy, first, you're going to do the bed. Second, you're going to do this. Third, you're going to do that. Also, we might use things like using a timer. Okay, let's do a challenge. You're going to do your bed in 5 minutes. Can you do that? And so creating that excitability is going to create that connection with, ooh, this is a challenge. This is fun. And that is going to engage someone that has ADHD. Also, you just got to get creative sometimes, even with prizes, something including the senses in how we're doing things. So for example, can we create a board of chores where we can maybe add stickers when we do things properly, right? So something that Timmy can see, oh wow, look, I'm doing well here. People can see that I'm doing what I need to be doing, and that creates a sense of pride and joy. It's going to help that child be more receptive to this work. A lot of encouragement for movement, especially. So, especially with the hyperactivity part, we want to see how we can refocus that energy. So, I have with me a list of like a little box of fidgety toys here that you might want to have that are really, so these are tactile things that are going to be helpful in re-engaging somebody with their senses. Like, look at all the different colors and different texture, things that are engaging smell. These are all things that are going to help in releasing some of that energy that we have, that movement, but also that's going to then help us kind of refocus. Okay, energy's out. Let me refocus back. Using metaphors, using stories, using catchy acronyms. So really getting creative with the way that we are setting goals for someone that has ADHD. So what are some tools and resources here that we can use? So again, back to emotional regulation and also helping release some of that energy. I'm going to share with you 2 skills that are super, super helpful for anyone that is really anxious or just has a lot of movement or is feeling irritable. So the first one is progressive muscle relaxation exercise. And what that means is that we're going to engage different muscles, tense them up, and then release. How we can explain that to a child is through, okay, give me strong man, give me strong girl, strong woman. So what that's going to look like is they're going to put up their big guns like that, and they're just going to tense. And you're going to tell them, okay, I want you to hold that for as long as you can. I know you can't see, I can't see you, but go ahead and try this so that you can notice just what it feels like to just hold that kind of tension, tensing the abs, tensing the shoulders, the arms, even the face, and then go ahead and release and take a deep breath. And that should feel really relaxing to you. Definitely don't hurt yourself though, but there should be a sense of letting go. Then, after you notice that, then re engage in, okay, let's go back to homework or let's go back to the task at hand. Also, another technique is box breathing, and that's engaging our nervous system and using our nervous system to let our brain know that we are safe. So if you notice when you're scared, we do that shallow breathing when we're scared or we're really angry. And so what box breathing is going to do is elongate the breath, which then sends a message to the brain saying, oh, we're actually safe. Like you can stop with the adrenaline and the tension because we're actually in a good place. So what box breathing is, you're just going to pick a number, let's say 5, let's say 6. You're going to inhale for that number. You're going to hold for that number. Then you're going to breathe out for 5. And once again, you hold for that number. And that is really helpful for anyone that's really stressed, that's suffering from anxiety, and or that has that pent-up energy that needs to get rid of that. Also, a kid-friendly one is just as simple as, hey, tell me what your favorite hot beverage is. Kids will usually say hot cocoa because, what kid doesn't like hot cocoa? And you're going to let them know, I want you to envision that you have this big cup of a beautiful hot cocoa. And I want you to go ahead and just take a big, big inhale in, really smelling that beautiful chocolatey smell. And then you're going to just release. And so they should feel a sense of relaxation, a sense of letting go. And what's happening biologically is that our vagus nerve is what it's called, is sending a message to the brain, the survival part of the brain, to let the brain know, actually, we're doing really good today. We're in that rest and chillax, that rest and digest space. So some of the other things that are really helpful to keep in mind with a brain that has ADHD is the other parts that we can support functioning to our highest level. So what that's going to look like is making sure that we're taking our medications. Sleep is huge. If you think about it, the way that cognitively you show up when you only have 3-4 hours of sleep versus when you have 8. If you think about diet, what do you feel like in your body when you've been eating some good veggies and good food and drinking water versus when you haven't been able to feed yourself well? Also, giving up the idea, externalizing means giving up the idea that we should keep everything here and really taking advantage of things like calendars, our phone calendar, Siri, Alexa, to remember things so that we are not burdening our memory with more than it needs to. Using timers, things like that, using our technology so that we can kind of not have to rely solely on our brain. Emotions, definitely tuning into what big feelings are there and just being able to say it out loud can be so helpful, especially when kids are feeling big feelings. I'm feeling really sad right now. Just being able to say it in a safe space can really mean a lot to children. Time blindness. Again, people with ADHD really struggle with time, and that 30 minutes for actual time can feel like 5 minutes. So that's why they can really lose track of time easily. So keeping that in mind, what are some helpful techniques there that we can use? Yeah, so fuel your brain, externalize all the things that you can use your electronics for, feel your emotions, express emotions, and be mindful of time blindness. It's a real thing. So how do we handle goals here? So when we have a big goal, let's say the goal is, we're going to raise our grades for math class. So we set what the goal is. Then the goal is going to be, we're going to get 80 or 90 on our next test or not our next math test. So planning, okay, when is that test? Making decisions about how often do I need to study within the week in order to get that grade. evaluating choices here in terms of like, okay, yesterday didn't go so well. I kind of wasn't really all there. So what can I do today? So to get to study as much as possible, monitor progress. So, and then solve or complete the issue, figure out, has my method been successful? So let's talk a little bit about what services and resources are available here. So definitely when it comes to someone that has ADHD, if we're not sleeping well, we want to connect with someone who can help us figure out what's going on. Also, dietitians are really, really helpful when it comes to working with ADHD. And the reason for that is, remember I talked to you about that hyper focus? Well, if you notice, sometimes people with ADHD can hyper focus on a food. And if what that looks like is that we only want to eat mac and cheese, or everything else feels yucky, or this is the only thing that we're interested in. So working with a dietitian can really, really be helpful because we can't just eat mac and cheese. I wish we could, but we can't just survive on mac and cheese. So also what we notice is that with people with ADHD is that they will do something until they're sick of it. They can't do it anymore. And then that becomes an issue because now we don't know what else to do, or now we completely eliminated whole groups from our diet, which was going to be an issue. Also, with work, connecting with Americans with Disabilities Act. What are our rights? What are our supports at work? Job accommodations, being able to ask for the things that we need, knowing our rights. In school, being able to know, okay, do I qualify for an IEP? Do I qualify for a 504? And if what these things are just specialized services where someone that has ADHD, for example, might be able to take a test separate so that the noises, the little things that feel really overwhelming to someone that has ADHD isn't something that they have to deal with. Family therapy is huge help, huge help. Again, one of the biggest issues with ADHD is feeling shamed or feeling like we're different or feeling like we're not okay the way that we are. And sometimes our family and friends can make us feel that without realizing that they are. And so family therapy can really help in facilitating ways to build communication, ways to express ourselves. That could be very, very helpful. Again, time blindness. How do we deal with this? How do we estimate things? So that we get what we want. So, for example, one issue is if we forget our medications because, oh man, I forgot I was supposed to take it in the morning and it didn't happen. Using problem solving, cutting into little pieces means, okay, well, let me look at what is the issue here? What am I seeing here? Oh, I keep losing my medication, so I don't know where I put them. I forget if I took them already. Renewals are really hard, and keeping the appointments is really difficult, or knowing when to pick them up. So now that we know what the issues are, then it's just about figuring out, okay, well, what are the questions here? How long does it take for me to drive to get my meds? Let me delegate to delivery service and an automatic system so that I don't have to be in charge of calling or going there to pick them up. Set an alarm in your calendar. So again, using our electronic calendars, most of us always have our phones on us. So these are really, really helpful ways to keep connected to what's going on here. And also noticing how long it takes to take our meds here. So noticing what time of the day, noticing just, okay, this is just 2 seconds. And if I do things like if I put my medication right next to my bed with a bottle of water, I don't even have to worry about getting the water. I can just kind of wake up and just be done with it. So really simplifying things in order for us to meet goals here. So let's talk a little bit more about externalizing. So how do we offload from memory? How do we use our senses in order to help us remember things? And so what that can mean is make things visual and make them auditory. So again, using our electronics, having schedules around, having big calendars where we can see, using sticky notes right on the door, like, oh, did you forget to take your medication? Putting things on our bathroom window Don't forget to do this. Our bathroom mirror. Don't forget, get really comfortable with leaving little tricks for you to remember things so that it's not all on the memory. So also, it's so important to normalize. This is it. There's nothing wrong with having ADHD. It's just something that is. And again, it can have its advantages, but also recognizing that this is just a normal condition, and that it doesn't have to be a bad thing. It doesn't have to be a shameful thing. It doesn't have to be something that we hide or that we can't talk about. So just normalizing, oh man, you know, I gotta write this down right in front of me as we're making plans, or else I'm gonna forget because it's just how my brain works, right? So also recognizing that someone that has ADHD might need a little bit more information about boundaries in terms of, okay, how do I say no? Because sometimes we can just impulsively want to please other people, that we're not recognizing, wait, is this something that I want to do, or is this something that I that I'm saying because someone else asked me. So noticing that, as well as being able to take accountability. Oh man, although I have ADHD, I haven't been using my calendars or my sticky notes in the same way, or I haven't been engaged in therapy for ADHD, or I haven't been taking my medication. And so that's something that I'm responsible for as someone that has this condition. And if you want to learn more, if you want to educate yourself more on ADHD, there's some really awesome books. The first one is ADHD After Dark. Highly recommend. And Your Brain's Not Broken by Tamara Rosier. Really, really wonderful book that really gives a little bit more information here. Also, again, instead of going against the grain, we go with the flow, recognizing that movement is part of ADHD. How do we get creative with finding an outlet for that? And so in the office, that could look like having a standing desk where we can move from standing to sitting so that we're not sitting for long periods of time for work. Alternating seats, using a balancing ball, wobbling sensory cushions, things of that sort can really be helpful with just moving the body and not staying still for that long with somebody that has a really difficult time. Also, toys, fidgety toys. So we have a few of this really helpful. And think about the difference of giving a child who has ADHD directions when they don't have anything in their hands versus when they have something that they can kind of spin around. They'll be able to channel that energy while focusing in on what you're saying. So these are really wonderful ways to exert some of that energy. Memory prompts, again, whiteboards, visuals, videos, really engaging the senses, smells, and things. Those are really great ways to reinforce memory. If you think about memory, the first thing that you smell something, it'll take you back to a memory. A touch can really take you back to a memory. So these are really great way of reinforcing information that we're learning by using our senses, by using technology. So again, one of the biggest barriers to really understanding our individual biology and how ADHD affects us privately and individually is a shame barrier. There is a lot of ideas that people that have ADHD are not good enough, that we're failures, that we're lazy, that we're bad, that we're stupid. And those are some really harsh things to believe about yourself, especially really early on. A lot of people with ADHD, especially the hyperactive type, have been branded as you know, disruptors and people who can't sit or who don't want to or who interrupt others, and that can really impact how a child develops their self-esteem and into adulthood. So it's just remembering that it's just we don't have to force what isn't there. If we are trying to do a skill, let's not go against nature. Let's go with our biology and taking into consideration. Okay, well, again, it's a deficit of time. It's not a deficit of the actual function. So with that said, again, a 10-year-old, we make sure that we adapt the lesson to a 7-year-old. So what that could look like is If your 16-year-old daughter is being asked to babysit a 1 or 2-year-old, remember that cognitively she might be at 13. And do we want to, is that an okay age that we would let someone babysit? If they want to go on a date at 16, do we want to maybe have a chaperone, or do we feel that they can advocate for themselves and really think through consequences, especially when hormones are taking over here? So it's just the little things of, do we want to let them drive a car at 16 when we know that cognitively they're 13? And something that I didn't share here that is true is that people with ADHD have a much higher incidence of car accidents than people who do not, because again, cars are serious business, and a lot of decision making is impacted by ADHD that's not diagnosed correctly, that's not being cared for. So something to keep in mind here. And so going back to emotional regulation, you're going to notice big feelings. You're going to notice really fast ways of just showing up, frustrated, angry. So keeping that in mind, the nervous system is really being impacted. So our nervous system is actually this thing that catches what feels safe and what doesn't, and puts us into that fight or flight activation or that freeze zone. And so what that's going to look like is, and that's for all of us. But again, somebody with ADHD, because of the way that the brain is set up, they're going to be more sensitive to it. So we have this amazing vagus nerve, which is a nerve that comes from the brain and basically envelops all of our organs. And this nerve is constantly looking for information that tells us that we're safe. It's kind of like that sixth sense. So if you ever notice, like, you're feeling that someone's looking at you and you turn around, your neighbor's there, or you can kind of sense that, oh, that car is going to do something erratic or something dangerous before it happens. That's what that nerve kind of does. It's always scanning for safety. And so what that means is that was for somebody that has ADHD, you want to really use body-centered approaches to calm the nervous system. If there's a lot of energy, if they're feeling anxious, if they're feeling a big emotion, is recognizing, okay, what's the emotion that's coming up right now? And then segueing into, well, let's see what's real right now, and what's the feeling, because feelings are valid, but they don't have to be real, right? So just recognizing it, okay, do we need to just take a breath right now? Do we need to take a moment back? Do we need to process what's happening here, so that we can disengage the body from the adrenaline, the cortisol, that whole fight or flight, or that freeze, that kind of shock freeze place when that happens when we're not safe. So when we are in a safe place, we can think this through a lot easier, because the first thing that shuts down when we're not safe is that cognitive ability. That because the brain, the survival part, is going to say, listen, you're too slow cognitive ability. I need to act quick, because there might be a bear, or there might be something big here. So when we quiet the internal fears that we're not safe, what happens is that our cognitive abilities will re-engage, will go online again, and we can think through issues a lot easier. And so we can do that through breath work. We can do that through that tensing and relaxing. We can do that by just disengaging from whatever feels overwhelming, and just keeping in mind, this is how our bodies work. So on medication, for those of you who have considered medication or who are exploring medication, there is a 70% reduction in symptoms that we see with medication. Medications, there are two types. There's one that is a stimulant, like Adderall, and there's some that are not. I think there's one or two that are not stimulants, that work in different ways. So there's not a just one thing fits all for everybody. There are options here. Sleep is, again, super important when it comes to ADHD regulation. When you have not gotten the sleep that you need, your cognitive functions are not going to be at their most potent abilities. We're already going to be at a minus here. So if you look over here at how much sleep is enough, 0 to 3 months, about 17 hours. But as preschools, 10 to 13 hours, teenagers need 8 to 10 hours. And as the older we get, the less sleep we get. Seniors, 7 to 8 hours, which I know a lot of you are like, wow, that's crazy. Where's the 6 hours that I usually get? So that's a good reminder for all of us that we're at our best when we are meeting what our physical body needs, and we might have normalized a lot less sleep than we actually need in the body. Diet and memory, if you are the way that you fuel your body is going to impact your brain function. So if diets high in fat, high in sugar are going to not be so great, are going to spike the blood sugar, which is going to lead to big energy and then a crash. If we're spending too much time in between meals, that's going to have an impact. That's going to really we're not going to feel good. If we're not eating enough, that's going to create an issue. And also if we're struggling with our weight, that's also going to be an issue in terms of our energy level and all of that good stuff. So keeping in mind that diet is really, really important. There is some research out there that shows a link between certain artificial colors and how ADHD is experienced. There is some good evidence there that there is a connection. There's some other stuff that there are not enough data out there in terms of like a low carb diet or just like an Atkins kind of diet. There is a lot of talk about that being effective, but there isn't a lot of research behind that. So being mindful of what you hear in terms of managing ADHD. And if you have questions, please reach out to dietitians because they know a lot of, especially when it comes to you would think that ADHD, well, they're not going to know how to treat that with food, but they really are knowledgeable. So please connect with a dietitian. So, something to keep in mind here, everybody is a genius. But if you judge a fish by its ability to climb a tree, it will live its whole life believing it's stupid. So, keeping in mind here that ADHD is an amazing way to think. It is a different way to think, but it is not worse. It is not um, a hindrance, and that there is a lot of brilliance that comes from the ways that we are that people that have ADHD are processing the world and how they're experiencing things. So keeping in mind that it's just a different way, and that we have to maybe shift out of that cookie cutter way of seeing education or seeing managing behavior. We might just have to think outside the box and definitely tune into your resources and your support, mental health, dietitians, family therapy, all of the good stuff, reading books on it, nutrition, all of that stuff is going to be helpful to figuring out what is going to be the best situation to increase those functions to the max that we can. So with that, I'm going to say thank you for being here. Any questions? I'm going to go ahead and stop sharing here so that I can hear or see people. Let's see. Oops. Yeah. So any questions, anything, I would really love to hear some feedback on some thoughts or some experiences that you've had, frustrations, wins, anything would be awesome to hear. Okay, so I can post here. Yeah, yeah. So you can post up here if you feel like, I don't know, I don't want to unmute. I don't want to. It's been a long day. It's been a long day. Feel free to go ahead and ask your question in the chat, and I'll be more than happy to answer. Boy, I hope I didn't put everyone to sleep here. Oh, I see a raised hand. Okay, Dean. Yeah, go ahead.
Oh, hi. I just wanted
Hi.
I just wanted to make a couple comments. I thought your presentation was excellent just to get an overview. And I don't have any well, I don't I am not I do not have ADHD, but my great nephew does, and he's 10 years old. And when this class became available, I just took it because I thought I just wanted to learn about it. Um, Nothing, I don't see my great nephew every day, but just the fact that I'm a little bit more knowledgeable, and understanding ways to work with people who have ADHD and just to be patient. So I thought your presentation was very good. Um, Gave me some new wording to think about, and even for myself, in terms of relaxation and breathing. I think that's all important for us, whether we have ADHD or not. So I want to thank you very much for that. And I appreciate what you've taught to all of us.
Oh, thank you so much. I'm really, really happy to hear that you took time to see how much you love your great nephew.
Yes.
The fact that you were able to tune into that and want to learn more about what he goes through and how he experiences the world, that really says a lot about you.
Well,
I hope, yeah, I hope he sees that.
yeah. Yeah. Thank you very much.
You're welcome. Glad to be here. Yeah, so I work with a lot of clients who have children who have ADHD, and a lot of what I hear is just a lot of frustrations like, oh, Kenya, I can't get them to do this, and I can't get them. They don't listen, and it doesn't matter. I'll say things 100 times, and they just they don't seem to listen to me. And so the frustration is real. So, as caregivers, 100%. Don't feel embarrassed or shame or guilty. It can, when we don't understand something, it can be really frustrating, especially because there's so much pressure that we're putting on kids to learn a certain way and to sit for 8 hours and to be able to pay attention in ways that might not be biologically okay to them, that might just not be accessible. So definitely, if you have some of those stories of just not knowing what to do or feeling overwhelmed, feel free to express that, because that is real.
We had one question about what's the process for getting your child evaluated if you suspect they have ADHD?
Oh, Sarah, I hear you, but I don't know, is it me? No,
Oh, sorry, I'll
hmm.
go ahead. I think Kyle actually was the one who wanted to be able to just share that question. I can let him talk. But there's a question about the process for getting your child evaluated for ADHD if you believe they might have it.
Yeah, so your doctor, your primary care provider is going to be a good bet. Also, aside from that, a behavioral health therapist. So in Avance, there is a really great section of our therapists who specialize in ADHD and who specialize in how to diagnose it. So that's going to be really important. And what the diagnosing process is like, it's going to look at multiple. So, is your child showing up in these ways in more than one place? So, are they just being rambunctious and not listening at home, but then when they're in school, they're perfect angels and they're doing really great? Or are you noticing this behavior in multiple settings, and it doesn't matter how stressful the situation is? So it could be a really relaxing vacation and they're still showing up in ways that where they're um, hyperactive, where they're having a hard time paying attention, where they're not forgetting things. So the test is going to look for the behavior across multiple settings and in different kind of intensity in a way. And then it's going to test for working memory. It's going to test for like, being able the ability to focus. So a brain that neurotypical brain who does not have ADHD can hold up to 7 pieces of information at once. So that's that multitasking. You know, I can think about one thing and also six other things be doing a whole bunch of other things. Somebody who has an ADHD has the average ability to hold three things at the same time. So those are the things that are going to be tested for ADHD. I hope that was helpful. Oh, so I'm going to read no questions, but thank you so much for all the great tips. My 17-year-old son has coped well without medication until he hit high school. And now I can see he's struggling to keep up with the increased workload and socializing in large public high school. Yeah. So we may look at medications, but your webinar was a great tool for dealing with day-to-day struggles in the meantime. I'm glad to hear that. Also, I would highly recommend, if it's accessible to him, meeting with a behavioral health therapist who specializes in ADHD, because they can help increase those areas where he's deficient in, so that he can figure out little kind of like tricks on how to get through whatever the symptoms of his ADHD are showing up as. So something also to consider. Medication is a great option. Also, behavioral health might really be helpful with figuring out the tricks that are going to help him get to his goals. Anyone else? I think, Jadine, your hands I don't know if it's still up, or if you have another question, go ahead, and if you do, if not, never mind me.
Kenia, do you want to share really quickly the slide about the survey so that anybody can give us any feedback?
Oh, yes. Thank you, Sarah. Thank you so much. I would have so forgotten. Let me share my screen again so that you guys can have access to. Okay, let's see. All right, so let's see. Oh, here we go. Yeah, so please, we would love your feedback. And if you want to hear more about behavioral health services, focus for ADHD or not ADHD, please feel free to connect to those QR codes and let us know what you think. And if anyone, I'm going to go ahead and move on to the next. Yep, we'd love your feedback. This is some more information on, yeah, quick survey so that we can improve on future webinars. And that's me, Kenia Martinez, licensed clinical social worker. Yeah, so if you're trying to reach out to me, that's the way to find me. Yeah, so yeah, it seems like everybody got what they needed, hopefully. Again, if you think about something in the future or tomorrow, tonight, or something, you definitely can reach out and ask away. Thank you for your time. There could be so many other things that we could be doing right now. And I am very grateful that you took time out of your very busy schedules to come here. And I hope this was helpful. I hope this helps with your loved ones and with understanding ADHD in a different light. Thank you so much, and I hope everyone has a good night.